today's topic is say no to aches, pains, and migraine. And for those who are new, SHARAN has a 5-point plan, which is really simple. And I won't go into details about this today because it's in so many of our talks, but basically that everything should be plant-based. Why plant-based? Because when we're young, we've been told that we are omnivores, but really a true omnivore can pounce on its prey, tear it apart, and eat it raw. A carnivore or an omnivore, but we can't. We can only eat plants raw, and therefore we should be plant-based. Also, every animal on the planet eats their food whole, and so should we. And whole means no peeling vegetables or fruit, or no peeling, no refining things like sugar or white rice or white flour or any of those things. And then organic, and we're the only species that sprays our food with poison so that other animals don't eat it, and then we eat it. How could we do that? And then if you do plant-based, whole, and organic, you're eating as close as possible to what nature intended. Of course, there are ways to get even closer, but this is a start. And if you do that, the chances are that vitamin B12 and vitamin D can be low. They can be low for anyone on any diet, but if you're on SHARAN's 5-point plan, you're unlikely to be low on anything else except vitamin B12 and vitamin D. And therefore, these are always checked and supplemented if necessary. Now, this is a basic. Let's go straight into aches and pains, and you will understand why this is so important partially. I also want to say that I can't say everything about aches and pains, and that's just because it's such a vast topic, but I will try to do the very best that I can in this short time. So, whenever we feel pain, say you feel a prick of a needle on your finger, and then there's a nerve that takes that sensation and it's projected into the brain, and then the brain has another nerve coming back, which is the motor neuron. So one is a sensory neuron that sends the sensation of pain to the brain, and then the brain reacts and sends a signal back, and this happens so fast so that you take your finger away from the painful object. So in general, our brain notifies us when there's pain. And whenever we have aches and pains, our tendency is to reach out to some tablets, right? And that's just because of our conditioning and the way we've been brought up to think that for every ill, there's a pill. But as Reena said, aches and pains occur in our body. It's our body speaking to us to tell us that we are doing something wrong and that we should make certain changes to correct it. Now, there are a whole bunch of painkillers, but painkillers can be in 4 categories. Number 1, the regular painkillers like paracetamol, then the non-steroidal anti-inflammatory drugs like ibuprofen, aspirin, diclofenac gel, and so on. And then there are doctors who use antidepressants to relieve pain as well, especially for chronic pain. And then if the pain is really severe, opioid painkillers like codeine, morphine, and tramadol. We'll talk about each one of these. So paracetamol comes under the trade names of Panadol, Calpol, Dolo 650, Crocin, Tylenol. We all know these names. And the side effects are less in general, but everything that we put in our body is broken down by the liver and excreted by the kidneys, and therefore there's always a load on the liver and kidneys, especially in people who take painkillers every single day. And I've seen a lot of patients who are doing this for years and years. Then there are the non-steroidal anti-inflammatory drugs like aspirin and ibuprofen and so on. And these have certain side effects like indigestion, stomach pain, heartburn, acidity, ulcers. They can also raise the blood pressure. And the long-term risk is, of course, kidney damage, but can even be cardiac risks. And then there are antidepressants. And these are some of the common drugs that are used as antidepressants. And you have to look on your package, which may have another name, a trade name, to see what are the ingredients, and then you see which kind of drug it is. And the side effects of these are, the minor side effects, I would say, are dry mouth or blurring of vision or slurring of speech even, or constipation or drowsiness. But also it causes weight gain, excessive sweating at night, discomfort, and the worst side effect is that these are highly addictive, and that's why we really want to avoid them. And then there are the opioid painkillers like tramadol and codeine and morphine, and some cough syrups also have codeine in them. And the side effects of these are the effects of morphine on the body. So it can cause constipation or slowness of breathing or confusion or, just sleepiness, because opium puts you to sleep. And of course, it's very addictive, very, very addictive. So much so that morphine is very difficult to get. And there are people who, instead of getting morphine, they take codeine in the form of cough syrups as a drug. So, this is the kind of addictive property that these drugs have. So the main reasons to avoid painkillers are, number one, they don't address the cause. That means if you have a problem and you take a painkiller, you're not solving it. You're just handling it temporarily, right? Then they are very addictive. So often when we take painkillers, they last for a few hours and then we reach out to the next one and the next one, and they have side effects. And I mentioned so many side effects, but the biggest side effect is that they allow you to make movements that your body was telling you not to make. And therefore, that pain that you have, which is a signal from your body to do something, can become chronic and never get solved. So that's a real issue. So this is what I just said. And that's why we really want to avoid painkillers altogether. So in order to remove a problem, we have to always address the cause. Painkillers address the symptom. We want to address the cause. So now let's look at what are the causes of pain. And number one is injury. We all know that, right? And so we look at each one of these and what we have to do to avoid them. And then inflammation causes pain. Lack of oxygenation causes pain. Functional or structural disturbances cause pain. Like, for example, if you have diarrhea is a functional disturbance, but you can have cramps in the stomach, or menstrual cramps is a functional disturbance. And structural disturbances are like, for example, if you have polyps in the uterus, which are the cause of the pain, or some kind of tumor that's pressing on a nerve that is causing pain, right? These can be the main causes of pain. So for injuries, what do we have to do? If it's an open wound, clean the part and cover it. Now, I know a lot of people who take some kind of antiseptic or antibiotic and put loads of it on their wound and then wrap it up so that there's all this antiseptic inside. And that sounds good initially, but it's not good, because that kind of antiseptic also kills the cells which are trying to grow back. So what we really need to do is just clean it so that bacteria do not multiply there, and cover it so that no more bacteria come, and then allow the body to heal. Also, we should minimize any movement that causes pain. The body is producing pain in order to tell us, don't make that movement. We should avoid painkillers and anti-inflammatories for that very reason, that if we keep moving, then that part cannot heal. And the healing takes place from within. So what we can do to assist is, if vitamin B12 is low, we can make sure that it's in place. If vitamin D is low, we can make sure it's in place. And if the injury is such that, say, a bone is broken, we can make sure that the two sides of the bone do not rub against each other or move, by putting a plaster or doing something like a splint to make sure that that joint doesn't move. And then healing takes place, because our body knows how to heal anything. And we can have surgical support or any other support if needed, like a splint, or even, if the injury is really severe, you might need stitches, or you might even need a plaster if it's a fracture, or you might need surgery, actually some screws or some plate to hold the bones together, right? So if it's an injury, we need to check where is the injury and what do we need to make sure that the body is allowed to heal. Now, if it's inflammation means that part becomes red and hot because something's wrong, which causes the blood to rush to that area. And the blood is rushing to the area in order to help it heal, right? So if we take an anti-inflammatory, it's not good. For example, I had an accident and I fell off a bike and I had some injuries, and I went to the hospital and they checked me and checked that there was no fracture or nothing. And so all I had to do was clean the injuries and leave them alone. But they offered me painkillers and anti-inflammatories. And I said, no, I don't need that. And the doctor looked at me and said, yeah, you don't take it if you don't want to. So, but most people don't know that they shouldn't take it, right? Now, whenever there's an inflammation, it's called itis of that part. So arthritis means inflammation of the joints. Chondritis means inflammation of the cartilages. The spondylitis means inflammation of the spine, or tendinitis means inflammation of the tendons. Or you can even have inflammation of organs, like hepatitis, inflammation of the liver, pancreatitis of the pancreas, meningitis of the meninges in the brain, gastritis of the stomach, pneumonitis of the lungs, vasculitis of the blood vessels. So there can be inflammation anywhere, and systemic inflammation can be caused by one is injury. Naturally, when we get injured, then there's a chance for bacteria to grow and the blood rushes there in order to heal. So an infection can also cause inflammation. But then there are inflammatory foods that produce free radicals in our body, like meat and animal products, and also certain like ready-made foods, packaged foods with chemicals. These can be inflammatory in our body. And the opposite of that, or foods that can control this inflammation, are foods full of antioxidants, fruits and vegetables and all fresh things. And then chemicals and medicines can also cause inflammation. We know that many medicines are acidic, and therefore we often take antacids when we take medicines. That's because they have an inflammatory reaction. And then acid-yielding foods also, like sugar is inflammatory, and salt can be inflammatory, and then Also, tea, coffee, colas are all acid-yielding foods that can be inflammatory in our body. And then autoimmune diseases, where our body produces antibodies against itself and causes repeated injuries inside the body. These can cause inflammation as well. So just to go into a little more about inflammation, I'm going to stop my share and I'm going to ask Dr. Suman to share her story. Dr. Suman is one of our facilitators, and Dr. Suman is known as our eco kaki. But Dr. Suman once, a few years ago, came to our 21-day health retreat, right? Dr. Suman, do you want to share your story of how you got better?
Thank you. Thank you, Dr. Nandita. In fact, I'm here to share the life-transforming experience we had when we went for SHARAN retreat. In fact, I and my husband, both of us went. I must tell you that I'm a vegetarian by birth, but I was taking dairy, milk, cheese, butter, ghee, everything, curd. And I used to have lots of health problems. I had severe cervical spondylitis at the age of 35. And I had severe bleeding in my periods. So, I had this dysfunctional uterine bleeding. So I had to undergo uterus removal, hysterectomy surgery. And they also removed ovaries because I had ovarian cysts. So this led to, severe to profound osteoporosis. So I was having pains and aches in all my body parts when I was just 40. And I was undergoing bone densitometry almost every year. After maybe, when I was 47 or so, one of my friends said that it is not yielding any information. So I stopped doing that bone densitometry. And my daughter-in-law happens to be a student of Dr. Nandita, and also, she's a certified plant-based nutritionist. So she was telling me to leave dairy. But my conventional upbringing, that milk is good for me. So I didn't listen to her. But then they sent me to SHARAN retreat as a retirement gift for me. And because I'm a scientist by, profession, I wanted to have proof and evidence for everything other than what my body was telling. So after we went to SHARAN, in 21 days, they do it very scientifically. On second day, they do our test, and again on 20th day, they do the test to tell us how our body is responding. So within 20 days, I want to share with you, that my cholesterol levels came down, my blood pressure medication was reduced to 0. And my C-reactive protein, which is a marker of inflammation, was down. It was down from 5.2 milligram per liter to 4.1 milligram per liter within 20 days. And now, after 6 years, again I have done it on 27th of July 2023. It has come down to 1.4 mg per liter. Just because I have adopted this SHARAN lifestyle, this 5-point plan, which Dr. Nandita just told all of you. And, another thing which I have always studied and I have been told by the doctors, that bone densitometry is a test which of course exposes you to X-ray, but it tells you, that how your body is responding. So it is this osteoporosis is supposed to be a progressive disease. So with age, it worsens. So I will share with you my bone density levels. When I was 42 in 2000, my bone density in spinal region was 0.76 grams per centimeter square. It reduced to 0.726 gram per centimeter square when I became 47. In 5 years, it reduced. Then I stopped doing bone densitometry. But after doing SHARAN, again I did after 1 year. Just to, tell myself that yes, it is happening. So when I was 61, my spinal region bone density increased 1.019 gram per centimeter square. So see, from 0.76 gram per centimeter square, it has increased to 1.019, whereas it was decreasing earlier. So it might have become maybe 0.6 or 0.5. So it has almost, improved so much. And even my whole body density, bone density improved. from 0.86 grams per centimeter square to 1.013 gram per centimeter square after just 1 year of adopting whole food plant-based lifestyle. I have not repeated it again because now I'm very confident that it is happening and all my pains and aches are gone. In fact, I used to take this ibuprofen. Almost every second day, I was popping 1 or 2 pills. And I don't remember in 5 years if I have taken 5 pills. So that is the kind of improvement. Other than pains and aches, the doctor always used to tell me that I am carrying a bag of 15 kg extra weight. So I reduced almost 17 kgs of weight. I reduced 2 sizes from XL to medium. And my energy levels are tremendous. I can go on from 5:30 in the morning till 10, 11, till when I don't sleep. So I can vouch for this lifestyle. Even my husband has in fact improved a lot. His blood pressure medicines are gone and all his other problems, even snoring used to be a big problem. So that has reduced a lot. So, and there is nothing which we are sacrificing. In fact, we are taught all alternatives. So we are taking other alternate milks if you need. We are taking curds. So you can make every dessert sugar-free. You can make oil-free food. So all these foods which were causing inflammation are gone. So my body has responded beautifully. So I'm grateful to you, Dr. Nandita, and your team for giving me this new life. Thank you. And I feel everybody should take advantage of this. And she's not prescribing anything which is not good for you. She's not giving you any medicines, only wanting you to change food, which is so simple and doable. If I can do it, everybody else can do it. Please go ahead and do it and benefit. Thank you. Thank you, Dr. Nandita.
Thank you, Dr. Suman, for sharing. And I can vouch for it because I've stayed at your house and I know that you made dahi vada and all these things for me. And it was really yummy. So I know that Dr. Suman is literally following this lifestyle and has benefited a lot. And I know how keen she is to share with the world. And thank you for all your eco champs and all the stuff that you're doing.
Thank you for giving this platform to be able to spread this message of good health to everybody.
Thank you. So I'm going to go back to my screen share. And we had just finished this slide. And so now we're going to see the image of a healthy joint. And this looks like a knee joint, but it could be any joint in our body. At a joint, there are 2 bones that come together in a spot. And there, at the end of the bone, there's cartilage. That's a softer tissue. And between these 2 bones with the cartilage on it, there's some synovial fluid, which is held inside a capsule called the joint capsule. And the synovial fluid is like a fluid that lubricates and keeps the joints, the bones from rubbing against each other to destroy the cartilage or the bones. So this is a healthy joint here. And you can see there's even a tendon that is the end part of the muscle that's getting attached to the bone. And so, it allows one bone to move again with the other bone in a joint. Now, this could be anywhere in the body. For example, it could be even in the spine. Like, in the spine, there are various vertebrae. Here you see the lumbar vertebrae, L2, L3, L4 are the lumbar vertebrae. And between these vertebrae, there's an intervertebral disc that you can see here, which is soft and which should receive a good blood supply. But when the blood supply diminishes, the disc kind of prolapses and pushes out. And so the space between the 2 vertebrae diminishes and the bones can even rub against each other and can press on the nerve. Here you can see the nerve, which is going through the spinal column, between the back part of the vertebrae and the front disc. And so anywhere that there's pressure or slip or prolapse can cause pain, because the nerves come out between each of these bones. And then there's another kind of inflammatory, but before I go on, I want to just stop my share and I want to invite Rachna. Rachna is another person who came to our 21-day retreat and in another year altogether. And both Dr. Suman and Rachna have done our training program to become facilitators. So Rachna is also one of our facilitators. And Rachna, would you like to share with them? In fact, many of them must have seen you, Rachna, because you've often been hosting many events, right? So would any of you, Rachna, would you like to share with them the effects of this on you?
Yeah, thank you, doctor. And thank you everybody for joining us. I am, as doctor mentioned, I am Rachna from Hyderabad. And 10 years back in 2013, I had a severe back pain and it was a slip disc, as doctor has mentioned. So the part of the disc between L4 and L5 had come out. And I had a radiating pain all the way down to my leg. And it was very difficult. I mean, I could not stand even for 5 minutes. So I was on complete bed rest, and doctor advised me to go for a surgery where they would remove the part of the disc which had come out. But I choose not to go for the surgery. And I was on complete bed rest for 3 months. And yes, I was taking medicine for pain and to reduce the inflammation. And after 3 months, the pain reduced. I was able to move around, but there was a lot of restrictions. I was not able to lift any heavy weights, and even going on long car journey was restricted. And I was not able, I was asked not to move, bend forward. So I was managing with this, and I had a nagging pain throughout the day. And every night I had to apply a pain balm to get relief of the pain. And I was going on with this. Then again, after 3 years in 2016, I had a relapse. So this time again, I had to be on bed rest for 2 months, and same restrictions, same I was managing. But then everything changed when I joined Dr. Nandita's seminar here on reversing diabetes and hypertension. So I had diabetes, I was hypertensive, I was taking medicine for cholesterol also. And after I joined Dr. Nandita's seminar and I started following this whole food plant-based, being a vegetarian, I had to stop only dairy and dairy products. And of course, I started cooking without oil. And following this lifestyle since all these years, my hypertension medicine stopped in 3 months. My cholesterol medicine stopped. And slowly, my flexibility increased. And now, all these years, I am completely free of my back pain. And my energy levels have also increased. So last year, I'd gone for the 21-day health retreat, where I did trekking of almost 10 kilometers. And it was pain-free, no effortlessly, without getting tired. I mean, I myself was amazed at my body that I could do this, because it was, when I went, my family, like my husband and my daughters, everybody said, please take care of your back, don't overexert. But I could do everything effortlessly. And yes, my energy levels are high now. And like Dr. Suman mentioned, and I mean, everybody who are on this path, I can say, like, we can work tirelessly from morning till evening without getting tired. And I also lost around 13 kgs of weight being on this journey. And the most, like, I'm now completely free of all medicines. And I do all weight training and everything. There's no restrictions on my any movement or anything. And my family is also following this. And my daughter also benefited. She was suffering from PCOD, and she got rid of her PCOD. And moreover, we all enjoy the food. It's not that we are deprived of anything. So my daughters, my husband, everybody, we all follow and we all enjoy our food also. And I'm really grateful to Dr. Nandita for taking us on this healthy lifestyle, because I never thought that I would be so completely pain-free of my slip disc. Because doctor, even when I go to doctor for some other reason, now he says, I don't know how this lady is standing without surgery, but I'm completely pain-free. So thank you so much, doctor, for this lifestyle. Thank you.
To Rachna, thank you for sharing. I know that, people are getting the impression, and it's true, that this is not a lifestyle only for aches and pains. It can solve so many problems, and also the truth is it's simpler to do than anybody might think. And once you start doing it, you don't feel like going back to the old lifestyle. Isn't that true?
Yes.
Thanks, Rachna, for sharing.
Thank you, doctor.
So I'm going to go back to my screen share now. And we're going to see a few more things. So gout is another severe, painful situation, which is inflammatory, and it's caused by uric acid within the capsule of the joint. And uric acid is a result of excess protein. So the very first thing we should do is avoid excess protein. And one of the reasons that so many people are getting so much pain is because they're taking protein and protein supplements and protein powders. And this can be very harmful because excess protein in our body breaks down into amino acids, and it's acidic in our alkaline body. So when we have excess protein, which is acidic or anything acidic, it has to be neutralized, and it's neutralized by taking calcium out of the bones. And so you could see that Dr. Suman, her calcium levels, the bone density improved just by being on a healthy diet. And Rachna also got so many benefits. So, and then another thing for gout, you should avoid all alcohol and avoid sugar. And this is such a painful condition. I've seen people scream in pain and not being able to sleep, but gout can be totally avoided. And I've seen so many people get free of this just by changing the diet. This happens so quickly that many people who had gout never experience it again. And so I can really vouch for things like what Rachna described, that like such a severe situation has gone, and we're going to see how soon. And then rheumatoid arthritis is an autoimmune disease. And in an autoimmune disease, it means that our own immune system is working against us. Our antibodies are destroying our cells themselves. And so here you can see in the joint that, the parts of the bones have been destroyed, parts of the capsule have been destroyed. And this is because of the antibodies that we are producing. So the joints can become swollen and tender, and the swelling and stiffness in the joints is usually worse in the morning. And if it lasts for more than half an hour, it could be rheumatoid arthritis. It's more likely to occur in the smaller joints of the body, the fingers, and especially fingers and toes. And because it's causing destruction of the bones, it can even lead to the joints being deformed, and therefore it's really important to look after it as soon as possible. And because it's a autoimmune disease, there's severe tiredness or fatigue and a general feeling of unwell-being as well. So there are two kinds of arthritis: rheumatoid arthritis, which is an autoimmune disease, and osteoarthritis, and we'll talk about that soon. And then there are many other kinds of autoimmune diseases as well, and many of them can cause pain: ankylosing spondylitis, psoriatic arthritis, juvenile idiopathic arthritis, lupus, fibromyalgia, polymyalgia rheumatica, and multiple sclerosis. And before I go on, I just want to share Sharanya's story. Sharanya came to me with rheumatoid arthritis, and many of you may have even seen her story on YouTube because she's inspired so many people with who have MS to go on this diet. And she's also doing some programs like dairy, no, sorry.
21-day healthy food challenge.
21-day healthy food challenge as well as smoothie challenge. And so many people have benefited from her programs. And now recently, she's done a program called, it's a mental health program or a mental fitness program called Ho'oponopono. And all these programs are true messages from her heart, because these are the things that have helped her. So Sharanya, would you like to share your story?
Sure, doctor. Yeah, that was not rheumatoid arthritis, it was multiple sclerosis.
Yeah. Oh, did I say rheumatoid arthritis?
No worries, doctor. Yeah, no worries.
Multiple sclerosis. Sorry. Yes.
Yeah. Hello, everyone. I'm Sharanya Abhishek from Chennai. About 7 years back, I got diagnosed with an autoimmune condition called multiple sclerosis. We didn't know what an autoimmune condition was or what multiple sclerosis was. When I read about it, it was very, very scary. Multiple sclerosis sounded very, very complicated with multiple complications. So I was prescribed immunosuppressants, steroids, and 20 other tablets. And that immunosuppressant I was supposed to have for my entire life. And that 1000 mg small little tablet costed us 800 rupees per tablet. And you can imagine the cost for that tablet alone every month. And apart from that tablet, it was the doctor's visits, the MRI scans, and you can imagine how much of expenses we would have taken. So it took a toll on our pockets and as well as my body. The side effects were too much. So that is when I was looking for alternatives, and we found Dr. Nandita and this beautiful organization called SHARAN. I took a 1-hour consultation with Dr. Nandita, and that 1 hour has changed my life. So in 9 months, I was able to stop all my medicines completely with the help and guidance of Dr. Nandita in a slow and steady manner. And it's been 5.5 years since I stopped all my medicines and I'm medicine free. Can you imagine a life without medicines? Amazing, right? Especially with an autoimmune condition. It's unbelievable, right? And so I know that this is a progressive disease. I still had a lot of pains and aches all over my body, especially on my knees and my hips, my breasts, my ears, my left shoulder. So, these pains were sometimes unbearable. I was not even able to climb up the stairs or get down the stairs for almost 4-5 years. Then I was not able to sit down and get up from a chair. I was trying to manage with everything. I was, trying to manage. I started to accept my pains because I thought I had to manage with them. But slowly, with Sharan's 5-point plan is where I started my journey with. Then at some point, I realized I had to cut down on grains. And when I cut down on grains, my pains started getting better. And slowly, I realized when I increased my raw portions, my pains got even better. So from 30% of raw and 70% of cooked, I slowly changed it to 40, 60, 70, 30, 60, 40, then it became 70% raw and 30% cooked. And now with this slow progress for the last 7 years from the 5-point plan as a starting point, now for the last 4.5 months, I have been completely on fruits, and I'm a fruitarian for the last 4.5 months. And this one has brought down all my pains to it has come down by 80%. So 80-85% of my pains have vanished in this journey. And it's like a rebirth for me now. I didn't even imagine I can live a life like this. I didn't even imagine I'll live a life without pains. It has been a beautiful journey since 7 years. So apart from the nutrition part and the physical health, I also practice yoga every day, and I run sometimes, I cycle sometimes. So this is the physical health part of it. So I also realized when I had this question, why I got this autoimmune condition, I realized that I had to take care of my mental space also. That is where it originated. So I started with meditation, sincere and regular meditation, and then went to Heal Your Life by Louise Hay practices. And now my latest discovery is Ho'oponopono. And with mental health and physical health both in place for me, I would say I am at the peak of my health, at the best of my health. I'm the happiest ever. I am, I'm able to do all my work with no strain at all. So I, in fact, even forget about that little pains that I have also. So I'm the happiest now, just like how Chandrayaan-3 landed on the moon safely just now. I have landed on my moon with the help of Dr. Nandita. Thank you so much, doctor, for all the guidance and all the help that you've given me. And I can't thank you enough for that one phone call that you made just when I was, when I was stopping the medicines. I will have this temptation to have this pill. But that one phone call, doctor said, please don't have this. Everything will settle down in a week. That was a phone call which was the turning point in my life. So thank you so much, doctor, for everything.
I can't say that I did anything, because really, Sharanya, you have done so much, and I know it's always been progressive. And I have to say that Sharanya's condition was pretty bad, because she had visual problems in the beginning, and she couldn't even carry her young baby daughter at that time. But now, Sharanya, you've come such a long way. So congratulations for what you have achieved.
Thank you, doctor. Thank you so much.
Okay, so I'm going to go back now to my share. Yes, it was multiple sclerosis, of course, and my mistake, I didn't even realize that I said rheumatoid arthritis. So I just want to say one thing that's very, very important. One of the main causes of any disease is compromised blood supply to any part of the body. So when we have less oxygenation to our back, you get back pain. If you have less oxygenation to your joints anywhere else, you get joint pains. If you have less oxygenation to your heart, you get angina. If you have less oxygenation to the brain, you get headaches. So everything is dependent on a good blood supply. And lack of circulation. So as I said, lack of circulation can be because of the arteries getting blocked. Like, for example, I'm just going back to the earlier slide. You can see that from this part, this is when we're very young, the arteries are wide open. But as we grow older, because of the fat in our diet, which thickens the blood and injures the artery walls, our arteries are lined over and over again with cholesterol, and they get narrower and narrower. And this can actually be reversed. So as our arteries get narrower, and I saw some questions about high blood pressure and so on, as our arteries get narrower, the heart has to pump harder to push the blood everywhere through the narrow arteries. And so that is higher blood pressure. And we can reverse this we can lower the blood pressure by taking the fat out of the diet. And that's why when I said whole food, I said that we don't consume anything that is refined, not even oil. And what all these people learned, that means Dr. Suman and Rachna and Sharanya, and obviously Reena, who is hosting me here, all these people learned how to cook delicious food without a drop of oil. You know, sometimes it's hard to believe that oil and milk are so harmful, but they are, because oil is full of fat. And to tell you the truth, milk and all animal products You know, vegetarians and non-vegetarians get the same disease because animal products are full of fat. So you boil milk, you get fat on top. You boil chicken, you get fat on top. You boil fish, you get fat on top, and meat too. It's very interesting that if you boil peanuts that are full of fat, you will not get fat on top because of the fiber that holds on to the fat. And the same is in our body, that if we consume foods with lots of fiber, only plants produce fiber. If we consume, but you know, sometimes we refine them, peel them, take off the fiber. If we consume whole plants, then we're consuming a lot of fiber. The fiber literally ushers the fat out of the body by keeping our blood thin. So we can reverse plaque in our arteries by keeping our blood thin. And sometimes we get pain because there's not enough circulation to joints or to muscles. And we can reduce that also just by making sure that our blood circulation is good. And that's why plant-based and whole is so very important in getting rid of pains. Now, in order to improve circulation, we should avoid naturally all oil, ghee, and butter. And believe me, oil, ghee, and butter actually don't taste good. But if you replace them with coconut, grated coconut, roasted crushed peanuts, roasted crushed sesame, or even nuts, they taste better anyway. And so the food really becomes delicious. Avoid all animal products, avoid dairy, it's also an animal product, increase the fiber, exercise. When you exercise, you're moving, so the circulation flow is better always. And make sure that vitamin B12 is looked after, because if vitamin B12 is low, the circulation can get a battering. Now, I told you I'd talk about our osteoarthritis, and this is one of the most common forms of arthritis. It's a degenerative arthritis that takes place because over a period of time, the blood circulation decreases to the joint. And so the joints, the synovial fluid is not as cushiony as it should be. The joints touch each other, they start rubbing against each other, and they start deteriorating due to the rubbing and cause pain. So what should we do to avoid osteoarthritis? We should avoid fat. We should maintain a healthy weight, because when our weight is more, then also we are putting pressure on the joints, right? Especially the knee joints. And osteoarthritis usually occurs in the larger joints. Rheumatoid arthritis starts in the smaller joints. And then maintain movements and exercise that don't cause pain. So we shouldn't do something which causes pain, because if you are rubbing the bones together, you will get pain. So you should stop rubbing the bones together, allow it to heal. And you saw how Rachna's spondylitis healed. So the same way the osteoarthritis will heal if we just take out the causes of the problem. Now we're going to one more painful situation, and that's migraine headaches. And migraine headaches means that we have severe throbbing or pulsating pain, usually on one side of the head, and it's often accompanied by nausea, vomiting, extreme sensitivity to light and sound. All you want to do is go to bed and make sure that all the curtains are drawn, because it's so difficult. And different people have different triggers with migraine headaches, but the causes are similar. So migraines is also can be because of lack of circulation. And it's well known that migraines are caused because of cheese and chocolates and fatty foods, because that's going to reduce the circulation, even temporarily, because as soon as we eat that food, it goes into our bloodstream, the fat, and thickens the blood. And that causes the migraine to occur. And then dehydration also thickens the blood. Lack of magnesium Magnesium is found in green leafy vegetables in abundance. So, we start the day with green smoothies, and there's a reason for that. And then some people, the trigger for migraines can be a lack of routine or delayed meals or being on an empty stomach. And there can be other triggers as well, like fear or anxiety, or even certain sounds or certain weather patterns. And of course, emotional disturbances and stress can play a part. And the solution is, of course, to remove the causes. Rashi is here with me, and Rashi is one of our facilitators. And Rashi is from Bangalore, and Rashi has benefited so much. Rashi, are you there?
Yes,
Okay.
I'm here.
Rashi has benefited so much that she has even started a whole food plant-based cafe in Bangalore, so that people who are suffering from this illness can be helped. So Rashi, do you want to share your story?
Yes, thank you. Thank you so much, Dr. Nandita. So hello all, I am Rashi from Bangalore, and it's a pleasure to share my story with you all today. I was suffering from migraine since mid-2000s, and it all started when I was in Switzerland for my PhD, where I ate more cheese and chocolates than I was in India. And the frequency of headache kept increasing from once in 3 months to thrice a month. So the headache was so bad that I couldn't do any work. As Dr. Nandita mentioned, I had to shut down completely and had to rest in a dark room until I puked. So the intense headache would last anywhere between 2 to 10 hours. So I was actually suffering from intense pain. I tried all types of treatment, allopathy, homeopathy, Ayurveda, home remedies, you name it. But nothing helped me to chase away these headaches. I was so desperate to try out any therapy to get rid of this terrible migraine. Finally, I was back in India in 2018, and I happened to attend a workshop by Dr. Achyutam Ishwar from Bangalore, and where I learned that going plant-based and whole food will help reverse my migraine. And that was unbelievable for me. So I decided to go plant-based overnight. And since I was vegetarian, all I had to give up was dairy. Just not directly, but also indirectly, So I quit everything that had ingredient as dairy, like biscuits, bakery stuff, etc. To my surprise, I never got any migraine attacks after that. So that was like a miracle for me. However, after 3 months into the diet, we happened to, travel around Karnataka, and we were visiting a temple where we were offered a small bowl of curd rice as a prasadam. And instead of throwing it away and rejecting, I thought, okay, it's a small bowl, let me just have it. So I consumed that because I didn't want to waste it. Within 1 hour of consumption of that small bowl of curd rice, my migraine attack hit me to the hardest. Okay. So it continued for 72 hours. That was the longest in my, entire experience and life. Since then, I knew that, my body wanted to tell me that this is not your food. So I actually listen to my body, and I don't take even a drop of dairy in any form since then. So now I am out of all my migraine attacks, and it has become a history to me. In addition, I felt a big difference in the state of mind by going plant-based. I don't get irritated with things that were irritating me earlier. Also, I had hypothyroid, which also got reversed. That was a side effect actually of going whole food plant-based. So the biggest challenge for me to go plant-based was not able to eat ice creams because I love ice creams. So I started a vegan gelato, homemade ice cream. You know, I make my own ice creams. So it's in North Bangalore. So anyone who is from Bangalore here are most welcome to visit my cafe. It's called Zero Vegan Gelato and Cafe. You can Google it. Yeah, you can enjoy the frozen desserts if you are in Bangalore. And I hope some of you will be able to relate to my story and will definitely benefit from my story. Thank you so much.
You know, we had a potluck in Rashi's beautiful cafe, and we got to taste some of the food as well. And amazing, just amazing. So thank you, Rashi, for doing that.
Thank you so much.
And I just want to let everyone know that Rashi is one of our consultants. She's our nutritional consultant as well. So she's been through the consultation training for nutritionists, and she's doing so many cases for SHARAN. Thank you, Rashi, for all the work that you do to spread health. What can we do to minimize aches and pains? We should minimize fats, maximize fiber, make sure vitamin D is in place, exercise, rest. Rest is the time when the body can heal. So it's really important to rest and not just go on and on and on. Avoid painkillers and avoid the pain, because the pain is something that we should not allow to happen, because that means that we are harming our body when the pain occurs. So minimize the pain with rest, exercise, of course, because that improves the circulation. But don't forget to rest, and hydration. So once again, SHARAN's 5-point plan, which you can learn for those of you who are new, and I know that many of you are new, is that everything should be plant-based, whole foods, organic, vitamin B12 and vitamin D should be checked and put into place. And I do want to say a word or two about calcium and osteoporosis, and that's because so many people think that calcium deficiency can cause joint pains or fractures. And the truth is that there's no known dietary deficiency of calcium in the world. I'm going to show you a chart which shows the amount of calcium in different foods. And you can see number one, human breast milk has 33 milligrams per 100 grams. That means 33 milligrams per 100 grams is enough for a baby who has no teeth and no bones to develop healthy teeth and bones. We never need more than that in our entire life, but because nature is so abundant, if we are consuming nuts and seeds and greens and beans, we are getting more calcium than what is available in human milk. And of course, cow's milk, number 30, has more calcium, 120 milligrams. But don't forget, even potato chips has more calcium than human breast milk, which means that it's hard to be low on calcium. Then why do people get osteoporosis? Because they're not able to assimilate the calcium, which is done because of vitamin D, and because they're consuming acid foods that take calcium out of the bones to neutralize. And that's why it's really important to look after your diet. So how can SHARAN support you? SHARAN can support you through our website. And I just want to mention that we have a brand new website that I'm going to share with you right now. So this is our website. This is a homepage. And from the homepage, you can scroll down and go to consultations or our events or recipe section. And we have more than 600 recipes. And we have a publication section, and we have books for you to download for free as well. The recipe book is for free. And so is our SHARAN Healthy Living book, because we want everyone to be well. Of course, you can also go through the menu to all these places like There's a section about us, and these are the SHARAN facilitators. Or we have a section on consultations and how you can reach out to us for consultations. The recipe section is just amazing, so please don't miss that. We have a whole lot of events that can help you. I told you that all these people are our facilitators. Rashi is our consultant, but Sharanya, Dr. Suman, and Rachna, they are our facilitators. And we have all kinds of events lined up for you. And some of them are free. And our next free event is the Salad Revolution. So please do enroll for that if you haven't been to it before. And then we have a very special section on frequently asked questions, which can be seen in, like you can pick your question, like the type of question, and get all the answers to them. So please do look at our new website. And I do want to mention that you have to now log in or sign in, and that's only to make it easy for you, because then it'll be a breeze to register for events and consultations or anything else that you want to later on. We also have a resources section, and here city directories is very important. It tells you where you can get organic foods in each city and where you can also buy, where you can find vegan restaurants in every city and so on and so forth. So do look at our resources section. We have a section on traveling vegan as well, and so on and so forth. So I'm going to end this now and just quickly, I'm going to go back to my share for a moment and quickly let you know which are the other ways that we can help you. Through our YouTube channel. This very talk will go on our YouTube channel later, and so that will be useful to you. And then we have newsletters and messages, and you can subscribe to these from our website. WhatsApp messages, little bits of information every single day to make you healthier and healthier. Recipes and publications and cooking classes I've already talked about. Here's the number for consultations, but you can also find it on our website. And we have 21-day retreat. And I know that there were questions on the 21-day retreat. And I just want to answer them quickly because I'm just going for the 21-day retreat in September. And I'm looking forward to it. And there are still a few places left. And I saw a question of somebody who asked, can I cure all these different diseases in the 21-day retreat? Autoimmune and severe acidity and GERD and IBS and strictures. And to tell you the truth, not all of these can be reversed in 21 days. But we have had people come in with 24 medicines and go out on 4. So a lot can be done, but many of your illnesses will take time, but you can get help and you will get better in the 21-day retreat. So, all these diabetes and hypertension and all can get better. If you have more illnesses, it takes longer. If they're more chronic or have been with you for longer, it may take longer, but you get lots of results in just 21 days when you do everything right.